Frank was 68 years old when he tripped over his own dog. It wasn't the dog's fault. Remy, a friendly old lab mix who never moved from his spot by the recliner, was exactly where he always was. The problem was Frank's feet. He didn't feel them hit the floor wrong. He didn't feel his toes catch the edge of the rug. By the time his brain registered that something was off, he was already falling, and his hand shot out to catch the side of the entertainment center on the way down. He got up. He always got up. That was the thing about Frank. He was tough, the kind of man who worked 40 years in a machine shop and never called off sick, unless he was genuinely sick and he couldn't stand. But that night, sitting on the couch, with his wife Carol fussing over a bruise blooming on his forearm, something shifted in him. "I didn't feel it," he told her. "I didn't feel the rug. I didn't feel myself falling until I was already going down." Carol had heard all this before, in pieces over the last 3 years. The tingling in his toes that started small, back when he thought it was just his shoes. The burning that crept up his feet at night. Bad enough some nights that he thought that he kicked the blankets off just to get the fabric away from his skin. The numbness that had slowly and without asking permission spread from his toes to the balls of his feet, and now, if he was honest, up towards his ankles. He'd been to his family doctor. He'd been to a podiatrist. He'd even seen a neurologist who ran a nerve conduction study and told him matter-of-factly, "You have peripheral neuropathy. It's fairly common, especially at your age. We'll get you on gabapentin and see how that helps with the discomfort." The gabapentin helped a little. It took the edge off the burning some nights, but it didn't stop the numbness from spreading. It didn't explain why this was happening to him in the first place. And when Frank asked his neurologist point blank, "Why is this happening? What's actually causing it?" the answer he got was a shrug dressed up in a white coat. "Sometimes we don't know," the neurologist said. "It could be idiopathic. It could be related to some mild pre-diabetes we're seeing in your labs. Honestly, at your age, it's just something we manage. Manage, not fix, not understand. Manage." That word sat wrong with Frank for a long time. It sat wrong with him the night that he fell over his own dog. The next morning, Frank told Carol that he wanted to look into this differently. Not another specialist who was going to hand him a prescription and a pat on the back. He wanted someone who was going to ask why. Carol found the name through a neighbor who mentioned a chiropractor in Bethel Park who specialized in exactly this, peripheral neuropathy, treated, though, what he called a root cause approach. Frank was skeptical. He always thought of chiropractors as backcrackers, not the kind of doctor who could untangle something as strange and stubborn as nerve damage in his feet. But he was 3 years into this and management wasn't working. He figured it couldn't hurt to listen. What struck Frank most about this first visit wasn't the exam table or the equipment. It was the questions. An hour of questions. Not where does it hurt, but questions about his health going back decades. What his blood sugar had looked like over the years, whether he'd ever had gut issues, what medications he'd taken and for how long, whether anyone in his family had thyroid problems, whether he drank alcohol regularly, what type of a day eating looked like for him, whether he'd ever been exposed to chemicals or solvents at work, whether he'd had any major infections, surgeries, or periods of high stress in his life. Frank found himself talking for the better part of an hour, and somewhere in the middle of it, something clicked for him. Nobody had ever asked him these questions before. Every other doctor had just looked at his feet, looked at the chart, and told him what category to file himself under. This was the first time somebody was trying to figure out why his particular nerves were failing him. Peripheral neuropathy isn't a diagnosis, the doctor told him. It's a description. It just means your peripheral nerves, the ones running from your spine out to your hands and feet, aren't working right. But nerves don't just decide to stop working for no reason. Something is damaging them, starving them, or poisoning them. It's our job isn't to manage the symptoms, it's to find out what's exactly attacking your nerves and then take that thing away. Frank had never heard it explained that way. Nobody had ever told him that neuropathy had a cause worth chasing down. He was just told to live with it. Over the following weeks, Frank went through a battery of lab testing, far more detailed than anything that his primary care doctor or the neurologist had ordered. This wasn't a basic metabolic panel and a shrug. This was blood work, looking at his fasting insulin, his A1C, his inflammatory markers, his full thyroid panel, not just the TSH that his old doctor had run once and called it normal, his B12 and folate levels, his methylation markers, and a look at nutrient deficiencies that are notorious for damaging the nerves when they run low for years without anybody noticing. The results told a story that Frank's other doctors had missed entirely, or at least never connected together. His fasting insulin was high, even though his blood sugar itself looked borderline normal, at least on paper. The kind of number that gets waved off in a standard physical. But high insulin sitting quietly in the background for years before blood sugar itself becomes a problem is one of the most common hidden drivers of nerve damage. In the entire country, it doesn't always show up as diabetes. Sometimes it just shows up as numb fate. His B12 was in a gray zone, technically inside the normal range on the standard lab reference, but functionally low, the kind of number that research has connected to serve symptoms, but when it doesn't cross the artificially low threshold most labs use to flag a problem. Frank had been on a common heartburn medicine for over a decade, one that was well known to interfere with B12 absorption over time. Nobody had ever mentioned that connection to him. His thyroid, when fully evaluated instead of just glanced over, showed signs of underactivity that had been building for years, sluggish enough to affect circulation and nerve health, but not dramatic enough to have tripped any alarms on a basic screening. And there was more. A close look at his gut health suggested a chronic, low-grade inflammation, the kind that often traces back to years of a certain type of eating pattern, alcohol use, or an unaddressed gut imbalance. Inflammation that, over time, can interfere with the body's ability to absorb the very nutrients that his nerves depended on to repair themselves. None of these things on their own would have necessarily flagged as an emergency. That was the whole problem. Each one by itself looked borderline. Together, stacked upon over the years, they had been quietly starving and damaging the nerves in Frank's feet and legs the entire time, while every other doctor he'd seen focused on the symptoms in isolation instead of the pattern underneath it. This is what I mean by root cause, the doctor told him, walking him through the results. Your neuropathy was never a mystery. It was never idiopathic. It was the sum of several things that your body was dealing with quietly for years. High insulin, nutrient absorption problems, a sluggish thyroid, and undergoing inflammation. None of them showed up as a 5-alarm fire on a routine physical, but your nerves have been living inside of that environment for quite a long time, and they were sending you a signal the whole way through. The tingling, the burning, the numbness. That wasn't random. That was your body telling you that something was wrong long before anyone was willing to listen. What came next wasn't a pill. It was a plan. The kind of plan specifically built around what Frank's testing had actually shown, not a one-size-fits-all approach handed to every patient. The plan had several parts working together at once because root cause care rarely comes down to a single fix. First, there was nutrition strategies aimed directly at bringing his insulin down and calming the inflammation driving his nerve damage. This wasn't a fad diet or strict joyless overhauls. This was a specific shift in the balance of what Frank was eating, reproducing the foods that were keeping his insulin elevated, adding foods that were adding eating patterns that supported stable blood sugar throughout the day, and cutting back on the ultra-processed foods that had been quietly feeding the inflammation in his gut. Second, there was targeted nutrition support, not a generic multivitamin off the shelf, but specific forms of B12 and other nerve-supporting nutrients that had been chosen because they matched what his labs actually showed that he was low in, delivering in forms that his body could actually use, given his absorption issues. Third, there was work on his thyroid, not simply throwing a thyroid medication at the number, but supporting the underlying function of the gland and the nutrients dependent on it to work properly. Fourth, and this was the part that surprised Frank the most, there was functional neurology work that was done right in the office. Specific exercises and therapies aimed at stimulating and retraining the nerves and the parts of the brain and spinal cord that process signals from his feet. Frank had assumed, like most people do, that once a nerve goes numb, that's the end of the story. He learned instead that the nervous system has a remarkable capacity to rebuild a communication pathways when it's given the right input, consistently over time. The same principle that allows stroke patients to regain function after years of injury. His nerves weren't necessarily destroyed. In many cases, they were starving, inflamed, and disconnected from a brain that had stopped getting a clear signal path from them. The goal wasn't to force new nerves to grow overnight. It was to remove what was damaging them, feed what they needed to heal, and retrain the connection between his feet and his brain. And fifth, there was simple, consistent follow-through. Regular visits to track his progress, adjust the plan as his labs and systems changed, and keep him accountable to a process that, frankly, asked more of him than the prescription refill ever had. Frank didn't expect much. When he started, he'd been let down enough times to keep his expectations low, but he committed to it anyway, because the alternative, 3 more years of managing the problem that nobody could explain, wasn't something that he could stomach. The first thing that Frank noticed about 6 weeks in was that the burning had eased. Not completely gone, but noticeably less. He wasn't kicking the blankets off every night anymore. Some nights, he didn't even think about his feet at all before falling asleep, which hadn't happened in years. By month 3, something happened that made him call the office just to tell someone about it. He was walking Remy around the block, and he felt the sidewalk change under his feet. The small transition from concrete to the grassy edge near the neighbor's driveway. He hadn't felt a texture change like that under his feet in longer than he can remember. It was such a small thing, but it nearly brought him to tears in his own driveway. Over the following months, his labs began to shift right along with his symptoms. His fasting insulin came down significantly. His B12 levels moved solidly into a healthy functional range. His thyroid numbers improved. The inflammatory markers that had been elevated came down as his gut health and nutrition improved. This wasn't guesswork or wishful thinking. This was the same lab panel, run again, showing his internal environment actually changing, not just his symptoms being masked. By month 8, Frank's numbers had receded significantly from where it had crept up to his ankles back down to around the tips of his toes. His balance, which had been quietly worsening over the years without him fully admitting it, had improved enough that Carol stopped hovering over him on the stairs. The burning at night was essentially gone. He stopped taking the gabapentin entirely, a decision that he made together with his medical doctor. Once his symptoms had improved enough, he felt that he no longer needed it. He had magically returned to the feet of a 25-year-old. Nerve damage that builds quietly over the years doesn't erase itself instantly, and the root cause care isn't a miracle switch, but the trajectory of his condition had completely reversed. He'd gone from a man whose neuropathy was steadily creeping upward and stealing more sensations every year to a man whose feeling was steadily, measurably coming back. The most meaningful changes for Frank weren't measured in lab values. They showed up in his life. He played with his grandkids on the floor again without worrying about how he would get back up or whether he'll felt his knees buckle underneath him. He and Carol take an evening walk with Remy every night, something that had quietly stopped before becoming a comfortable habit for years and had eventually become something Frank dreaded because of the numbness and the occasional stumbling. Now it's back to being the best part of his day. He got back into the garden this past spring, kneeling, standing, moving around on uneven ground without the constant low hum of anxiety about whether his feet He and Carol took a trip to their family's place over the weekend, something Frank had been quietly dreading for the last couple of years because of how much walking was involved and how unstable that he felt on his feet in familiar places. This time he didn't even think twice about it. He sleeps through the night. That alone, he says, changed his whole life output on getting older. For years he had assumed that the burning, restless nights and numb feet were simply part of the deal. Once you pass a certain age, something you gritted your teeth and lived because everyone told around him, that's just simply what happens. Now he knows this isn't true. His body wasn't betraying him because of his age. It was sending him a signal about specific, identifiable, addressable problems that had been building quietly for years. Once those problems were found and corrected, his body responded quietly in exactly the way that it was designed to. Frank still has his labs monitored regularly. He still eats differently than he did 5 years ago, although he'll tell you honestly that it stopped feeling like a diet a long time ago. It just became how he eats now. He does a set of exercises at home that were given to him as part of his ongoing nerve training. 5 minutes here and there throughout the rest of the day. It's just nothing. It requires him to stay engaged with his own health in a way that he never had to before. But compared to a life of steady advancing numbers, sleepless nights, and the quiet fear of what next year might take him, it's an easy route. Frank's case isn't unusual, and that's exactly the point. Every week, patients walk in with a story that sounds remarkably similar to Frank's. His years of tingling, burning, and numbness that steadily got worse. The neurologist who ran the standard tests, who confirmed the diagnosis and offered a medication to dull the discomfort without ever explaining what was actually causing it. A case of resignation that this was simply something that could be managed for the rest of their life, without the quiet, unspoken understanding that it would probably keep getting worse. The truth of the peripheral neuropathy is rarely a mystery once someone takes the time to actually look for the cause instead of just naming this symptom. Elevated insulin and blood sugar dysregulation, nutrient deficiencies, especially B12, often by a common medication, or absorption problems nobody thinks to check. An underactive thyroid that never crosses the threshold of a basic screening test. Chronic inflammation rooted in gut health, and in some cases, toxic exposure, autoimmune activity, or side effects from long-term medication use. These are identifiable, testable, and in many cases correctable. But they require someone willing to look past the label of neuropathy and ask the harder question. What is actually damaging this person's nerves? That's the heart of the root cause care. It isn't about rejecting conventional medicine or dismissing the value of medications that ease discomfort in the meantime. It's about refusing to stop at the symptom when there's always a deeper explanation underneath it, and refusing to tell someone that nerve damage is simply a permanent, unchangeable part of getting older. Frank's feet will probably never feel exactly the way they did back in his 30s. That's the promise. That's not the promise, and it would be honest, not honest to say otherwise. But he went from a man losing ground every year, tripping over his own dog in his own living room, to a man who is stable, improving, sleeping soundly, and back on the floor with his grandkids. He went from being told to manage his condition to actually understanding it and doing something about it. That's the difference between masking a symptom and finding the root cause. And for anyone reading this who recognizes a part of their own story in Frank's, the tingling started small, the burning that crept in at night, the doctor who offered a prescription but no explanation, the message is simple. Peripheral neuropathy is not something that you simply have to live with. It's rarely as mysterious as you've been told. There is often a very real, identifiable, and correctable reason that your nerves are struggling. It's worth finding out what it is. Looking back, Frank is candid about one regret. He wishes he'd asked harder questions years earlier. Not out of anger at the doctors who saw him before. He doesn't blame them. He understands that a standard 15-minute appointment isn't built for the kind of deep dive investigation that this case actually needed. But he wishes anyone, had told him sooner that we don't really know why this happened. Wasn't an acceptable final answer. He wishes he'd known that idiopathic often means that nobody has looked closely enough yet, not that there's generally nothing to find. He also admits that part of him didn't want to look too closely at first. There's a strange comfort in being told that a problem is simply bad luck, or simply aging, or simply something to manage. It takes the responsibility off your shoulders. If it's just bad luck, there's nothing that you could have done differently, and nothing more than you needed to do now except take the pill. Root cause care doesn't offer that same comfort. It asks you to look honestly at years of eating habits, medications, and how much you've been moving and sleeping and managing your stress. But for Frank, that honesty was uncomfortable at first. But it was also the first time in 3 years that he felt like he had any real control over what was happening in his own body. Carol noticed the shift too in him, beyond just the physical changes. He stopped being resigned, she said. For a while, he just shrugged when other people asked how he was doing, like he already decided that it was only going to get worse. Once he understood what was actually going on in his body, once he saw the numbers on his labs actually moving in the right direction, he had this look on his face that I haven't seen for years. Like I said, I finally got him back. If you're reading Frank's story or listening to Frank's story because you finally recognize pieces of it in your own life, the tingling, the burning, the slow creep of numbness, the sense that your feet aren't quite reporting for duty the way that they used to, it's worth understanding what a root cause evaluation actually looks like, because it's different than most people are walking in the door. It starts with a real conversation, not a 5-minute symptom checklist. Throughout history that goes back, looking at patterns in blood sugar, digestion, medication use, thyroid function, past infections, alcohol use, and nutrient status, because peripheral nerves are sensitive, and they tend to be the first place in the body to show the effects of an internal environment that's been out of balance for a long time. From there, it involves detailed lab testing that go well beyond the physical. Standard reference ranges on the basic panel are built to catch disease, not to check the slow, gray zone dysfunction that often sits quietly for years before crossing into a diagnosable condition. Functional lab interpretation looks at where numbers sits within an optimal range, not just whether it's inside the wide boundaries of not yet sick. And it involves a plan that treats the whole picture rather than a single number. Nutrient changes aimed at specific patterns show up in someone's labs. Target nutrient support matched to actual deficiencies is not a one-size-fits-all supplement regimen. Support for gut or thyroid function when those numbers are contributing to the pattern. and where appropriate, hands-on functional neurology work aimed at retraining the connection between the brain and the feet. Even after the underlying cause is addressed, the nervous system often benefits from a consistent, targeted input to rebuild the pathways that years of nerve stress have disrupted. None of this happens overnight, and it's worth being honest about that up front. Frank's turnaround took months, not days, and it required him to stay engaged with the process the whole way through. But the alternative, years of watching numbers slowly creep further up the legs while being told that there's nothing more to do with it than to take a pill and wait, isn't really much of an alternative at all. Carol's role in Frank's case doesn't get talked about enough, and it deserves a mention here. Because peripheral neuropathy rarely affects one person in a household, it's usually a spouse or an adult child who first notices the stumble, the hesitation on the stairs, the wince when the blanket touches the bare feet at night. It's often family members who quietly start reorganizing a house, moving rugs, adding railings, hovering a little bit closer during the walk, long before the person experiencing the symptoms is rarely and ready able to admit how much things have changed. If you're the spouse, the adult child, or the caregiver, watching someone you love lose their feeling in their feet and hands, know that your instinct to push for real answers is a good one. It's easy for the person experiencing the symptoms to talk themselves into it's not that bad, or it's just part of getting older, especially after being told by more than one doctor already. Sometimes it really takes someone outside the situation to say plainly that a real explanation exists, and it's worth chasing down. Frank's story isn't a promise that everyone's path looks identical, because it doesn't. Every person's neuropathy has its own combination of underlying causes, and every route plan has to be built around what someone's own body and labs actually reveal. Some people find their answers largely in blood sugar and insulin. Others find it in a stubborn nutrient deficiency or in an underactive thyroid that nobody screened for properly, or years of gut inflammation, quietly interfering with nerve repair. Many people like Frank's find that it's a combination of things that work together. What Frank's story does show is this. Peripheral neuropathy has a cause. It is very often findable, and once it's found and properly addressed, alongside consistent work to support and retrain the nervous system itself, real improvement is possible. Not just less discomfort, but the return of actual feeling, actual stability, and actual confidence in your own feet. Frank still remembers the night he tripped over his own dog. He doesn't dread stepping around Remy anymore. These days, when he takes that evening walk with Carol, feeling the ground change under his feet from the driveway to the sidewalk to the grass at the edge of the park, he says it's one of the small, ordinary pleasures that he never expected to get back. For years, he thought that particular feeling was simply gone for good. It wasn't. It was just waiting for someone to ask the right questions and go looking for the real cause underneath it.